Hi, and welcome to the Langley Connection. This is the show where health meets community, brought to you by Langley Health Services. We'll be sharing helpful tips, expert insights, and stories that matter to you and your family. Thank you for listening. We're excited to connect with you. Welcome everyone to the Langley Connection. My name is Brody and I'm your host, and joining us today we have Sunshine Arnold with Citrus County Fire Rescue. So thank you for joining us.
Hi, good morning.
Good morning. So you do a lot of different things. You're involved in a lot of different things. So your main role is working with Citrus County Fire Rescue, and then you're a social worker there, right?
Yes.
Licensed clinical social worker, but you also have your private practice on the side as well.
Yes.
And we'll go a little bit into that mental health, but I want to kind of learn a little bit about you. So are you originally from Citrus County?
I'm definitely not from Citrus County. I was born and raised in St. Pete Beach, Florida, so a little farther south.
Okay. Florida resident, though.
Florida resident. Okay. Spent a little time in this area. I was telling you in Sumter when I was a kid. And but no, this was definitely brand new to me. I went from St. Pete Beach, which is pretty small little island growing up, and then went to Florida State, lived in Tallahassee, which is still kind of like a small big town. And yeah, I came by way of the rest of life eventually to Citrus County to land. My husband had been here in his high school years, and his family was here, and this is where we settled down back in, I think, 2004. Okay,
perfect. So you still get a little bit of that water from Citrus County, being Crystal River and Homestead, so it's a little bit like St. Pete, probably not as big as St. Pete, obviously.
Right.
But so, I want to talk a little bit about your background. So I do know you were in the military, so thank you for your service. You were in the Marines, is that correct?
Yeah.
So what brought you from Marines to working in the mental health field?
Oh, it's not a straight line, that's for sure. So I actually joined the Marine Corps kind of during college.
Okay.
That 20-year-old, like, okay, what am I doing? I don't know what I want to do. And my solution to that was I was going to go join the Marine Corps and give myself some time to think.
Okay.
So a little out of the box.
Yeah, no, absolutely.
So joined the Marine Corps. I had, already decided on my career in social work. And while I was in the Marine Corps, I served during Operation Enduring Freedom and Iraqi Freedom.
Okay.
And came home, and I can say we definitely didn't get a whole lot of mental health support. Sometimes some encouragement not to talk about mental health because that would slow your return home, or, just speaking out about that at that time wasn't really encouraged and talked about. So finished my bachelor's and then went to work for the Department of Children and Families. So a very reactive role. Intervention, reactive, and really enjoyed working there, but wanted to do more for families. So I actually got recruited to the child protection team, which is still primarily an intervention role. And that's where I really was like, okay, I enjoy what I'm doing. I know I'm good at it, but I want to get to how do we prevent these things from happening? And then if they have happened, how do we help people heal? So my experience in the Marine Corps and then my experience working in child abuse and neglect kind of led me to, I want to be more of a solution than a reaction.
No, absolutely. And, you talked about kind of that stigma being a lot bigger. And I feel like we're trying to reduce that stigma as much as possible. And I think, the world as a whole is doing better at that. I think we still have a lot to grow into it. But I think it's really encouraging to see people talk about it between celebrities, sports athletes, whatever it is, people are more open to talk about it instead of hiding it, like you said, and not really talking about it.
Yeah, for sure.
So tell us a little bit about your current role. So you're with Citrus County Fire Rescue. I guess it's in a different role, right? So they don't typically, most fire rescues don't have a social worker with them on. So what encouraged them to bring, you on, and then what is your role there as well?
Well, first they had approached me just to help them with how their job description, they knew they wanted to bring on some type of mental health practitioner. And then while we were talking, it kind of became this like, okay, well, maybe this would be a fit for you. So the core program was the initial thing to bring on a mental health practitioner. And then, so that's my main focus, is to focus on the core program, which I know we're going to talk about later.
Absolutely.
And then what we have are high utilizers of the 911 system. So people that call often, and sometimes they call because it's a medical problem, maybe not an emergency, but many times those people are actually calling about a mental health struggle more than a medical emergency that needs the ambulance ride to the hospital. So I follow up with those individuals in the community and help them just educate, provide what we call psychoeducation in my field about mental health, about what they're experiencing, and then connecting them to resources, because so many individuals, they just don't know where to get help, especially for mental health, and especially our older population of individuals. And then the last hat is supporting our firefighters, our paramedics, and our EMTs. They see what we, call, they have chronic exposure to trauma. And, just like our police as well, I think we need to do a better job educating them about what their role is going to be and the effect that role can have on their own mental health.
Exactly.
And giving them the tools to come out of the career not as affected.
Exactly.
You can't stop the trauma exposure, but help them to deal with it.
Manage it. Yes. Oh, absolutely. I think we talk about Citrus County is the resources are available. It's just bridging that gap to help them find those resources or to know where those resources are. Citrus County is pretty big, I would say. It's growing quite a bit. So it's obviously there. We are there obviously to help with mental health as well. We have our behavioral health hub in Inverness, and then also a site in Homosassa and Lecanto as well that we can help. So we want to help as much as possible the community and be there to help for their mental health. So let's talk about Mental Health Awareness Month. This is May. So,
Yep.
The biggest thing is bringing awareness to all of it and really shining light and reducing the stigma. So what do you feel, why is this conversation so important? Why do you feel it's like mental health is so important for everyone?
I think, like you said, we've come a long way in our country, around the world, talking about mental health more, but it's still not a quote unquote normal everyday conversation.
Exactly.
And it needs to be just as normal as talking about your physical health.
Exactly.
It's very easy for people to say, I'm going to a doctor's appointment, right? You leave work, you're like, I'm going to a doctor's appointment, I'll be back in an hour. But how many people are willing to say, I'm going to my therapy appointment, I'll be back in an hour?
Exactly, yeah.
But you can't separate your health, your physical health, from the health of your mind, your brain.
Exactly.
Because that's what's in control of everything. They're completely connected.
Exactly, they are. And we talked about that in one of our previous episodes with Taylor. We talked about how important is mental health for physical health, sleep, and how they all intertwined with each other and, make us a healthier person in general. So I like to hear you talk about that. I think that's amazing. One of the things I want to talk about too is you talk about mental health. I'm a big golfer, so I listen to, they have a psychologist that they meet with. It's a sports psychologist. And so golf is half physical ability and half mental ability, and just having, like in sports, having that to not get so down on yourself or kind of push out the people that are not so nice to you. I think it's a huge aspect in that game. And just being easier on yourself. You know what I mean? Talking about it, and you hear some of these athletes really talk about it and getting the help and them not feeling bad that, hey, I'm going to go to that physical therapy or that the therapy appointment. And just like they're going to go if they're getting a massage or getting, anything like that, I think it's really important that they talk about it. So what are some misconceptions about mental health? What are some common misconceptions?
I think the most common are that seeking help for your mental health or saying I'm struggling is a sign of weakness.
No, absolutely.
Right? That something's wrong with you. You couldn't fix it yourself. You're broken. I think if all of us were honest, we've all had some struggle with ourselves, like you said, with mental health, with whether it's a golf game or projects at work, and you get down on yourself. And unfortunately, just kind of like the news gravitates to negativity and it sells, our brain automatically gravitates to negative thoughts. So if we're not aware of that and we're not cognizant and we don't know really simple coping skills and tools to combat it, then they can take over.
No, absolutely.
So I think that's, one of the biggest things.
Absolutely.
Is being aware.
Absolutely. What message would you like the listeners to know, about mental health, and like how should they, if they have a friend or family member that's struggling with mental health, what is the best way for them to help seek care or help them through that?
Yeah. Well, 1 in 5 adults in the United States have some type of mental health struggle. So that's 20% of us. Nobody can see it, but we have 5 people in this room. So chances are 1 or probably, two of us or more are struggling with something, I have no problem saying that off and on throughout my life, I've gone through struggles. And, maybe they're situational. Maybe you're feeling down and depressed because you've lost someone. That's completely normal. And it's okay to talk about. And I think, if you have a friend or a family member that's struggling, one of the biggest things is just asking them, are you okay? Yeah. Can I help? I'm here to support you. Because when we get down on ourselves, whether it's anxiety, depression, or anything else, it's really easy to feel alone. And it's really easy when you're the family or friend, you're scared to ask a question because you don't know what to do next.
Exactly.
So I think what we can all do is, if we're not in the mental health field, find out what resources are in our community. So if we have a friend, a coworker, a family member, our child that's struggling, when we ask them if they're not okay, and they say, no, I'm not okay, we know what to do next and to support them.
Exactly. One of the things that, I was able to do, that some of our managers was able to do, we did mental health aid first class. And it was huge. It was eye-opening. We're encountering it every day, but kind of sitting in a class format and learning a little bit more about it and taking a deeper dive into it is really interesting. And then, being that, just talking to those people, hey, are you okay? That those few words of, are you okay? And some people might hide it and say, I'm fine, but as long as you stay with them and keep connecting with them, but then if they say, no, I'm not okay, having that answer and finding that resource. Like I mentioned, Citrus County, we have it, we have the resources, just bridging that gap to get them.
Yeah.
So, we talk about as, if you have a family member or a friend that is struggling, how can we do it? But how can community, between organizations or community partners, how can they help with Mental Health Awareness Month and really try to, encourage that and reduce that stigma?
Yeah. The great thing is that there's lots of free training out there available. You talked about one of the really common ones, psychological first aid. A lot of the area NAMIs, the National Alliance for Mental Illness, most counties have a chapter or a chapter nearby, and they're really great about providing free training, either live or webinars. Psychological first aid, like you mentioned, is probably the best thing for just, people want to learn more information and not be scared to have that conversation and know what to do next. There's also lots of training out there. I know one of the big things people fear is, what do I do if a friend, if I think that they're suicidal? How do I handle that? That's the scariest thing, right?
It is.
And even when you're a graduate student in college and you want to be a therapist, that's the scariest thing for us.
It is.
And it really isn't that scary because you learn the tools. So there's also trainings. One is called QPR, Question, Persuade, Refer. And there's a lot of those available out free in the community through NAMI and other mental health organizations. And then there's also another one called Assist. So those are all things that you can do. Call your local NAMI, call whoever your local mental health organization is, and see if they have those things available. Because a lot of them are receiving grants to get that out in the community, kind of like we're doing with Narcan with the opioid epidemic. We're getting psychological first aid and those suicide intervention trainings out to everybody.
No, absolutely. So, Citrus County is big on, one, reducing that stigma, but also trying to increase those resources. The community as whole wants to help people, and that's one of the things that we kind of noticed, and we said, okay, Citrus County's on board. Let's jump on board too, and that's why we opened that Inverness Behavioral Health Hub.
You asked, and we said this is what we need,
exactly,
and it's booming. I think
it is. So it's staying busy and increasing that awareness that we're there. We have providers and professionals to help, between psych nurse practitioners and then also social workers that can help for therapy as well. So we want to talk about a little bit, you mentioned the CORE program. So the CORE program, what does the CORE stand for? So
Coordinated Opioid, it's Recovery or Response.
Okay.
I don't know why my brain just couldn't decide which word it was, but they're both in the same.
No,
but it's the state of Florida's response to the opioid epidemic. So it's not just Citrus County. All 67 counties in the state of Florida, I'm not sure if all are on board yet, but they will be. Okay. And everybody's just kind of coming online based on the need of that county. And I think their focus was looking at the amount of deaths in a county. So Citrus County was the 11th to be to come on board. Wow. And the program started, and almost all the programs, I believe, have a fire rescue component is one of them, and then the mental health and the long-term MAT provider as well.
Exactly. Yeah.
So our community paramedics were hired, I think, in May of 2023, and they were going out. And so what was happening is the epidemic started, people are overdosing, 911 calls, Narcan wasn't out in the communities yet in force like it is now. So people were calling 911 when their loved one, their friend, a person on the street stops breathing, they're unresponsive. We come out, we can administer because we had it at that time on our ambulances, and then we take them to the hospital. Well, what would happen at the hospital? They continue to receive treatment until they're stable. Many of them would leave against medical advice, but there was no, here's help. Here, if you're ready to, if you want help with the substance use, here's how we get you help. They would just go back out into the street, and unfortunately, it just created a cycle of overdose, 911, ambulance call, ER visit, back out, and it would start all over. So CORE was the piece to kind of break that cycle. So somebody overdoses, obviously we still want 911 called, they go to the hospital, but the difference is that ourselves as Citrus County Fire Rescue, our piece of the CORE program, peer supporters can come in as well and respond to the hospital, and we go and talk to them either there at the hospital or once they're back home and a little more comfortable, and we, say, you had an overdose. If you have a problem with opioids, we have a program to help you, and we explain about how opioids, it's not as simple as I just want to quit and they put it down. The body has physical reactions, withdrawal symptoms that I tell people is probably the most uncomfortable and sick you've been in your life if nobody's ever experienced them. Because there's a misconception in the community that if you want to stop using what they, drugs or substances, you just stop. Yeah. But opioids, your body becomes addicted, and it's not that simple.
Exactly. I think one of the biggest things, when I helped with the CORE program as well, is when y'all were there saying, all right, we're going to get you some help if you want to do it, not just letting them to schedule that appointment to get that help. You're right there calling us up and saying, hey, how can we schedule that appointment? Hey, they need to get in. And we're working ways to get them in within 24 to 48 hours, what we can, and going from there. I think that's huge for being there, helping them, right? And not just letting them just do it and figure it out on their own, bridging that gap. So I think it's amazing. I love the program. I think it's really beneficial for our community and really helping and changing lives, impacting lives. So I think it's really, I get excited about it. I think it's really, really interesting.
Definitely made a huge difference. And we've got a lot of success stories. And one really cool one was we were actually doing a fundraiser out at Texas Roadhouse. And one of the people working at Texas Roadhouse spotted one of us and pulled us aside and said, hey, I just want to let you know that I am one of the people that you helped, and I'm doing good now. I've been working here. I love working here. I have a stable place to live. And that's kind of the reason I was brought to the CORE program is it's not just the medication-assisted treatment. That's not the only solve.
Exactly.
Many individuals that are using substances have a lot of other struggles, and they need connection, whole health connection, holistic connection to resources. So that's why I came on board to help them understand the connection between possible a mental health disorder and the substance abuse. And it can go either way, right? Exactly. The mental health may have come first, and then the substances were used as a self-medication, or maybe they were using a substance and then it causes a mental health disorder, right?
Exactly.
So explaining that connection to them and taking away that shame and guilt and weakness from them, again, saying, this isn't your fault, but we can figure out a way out of it as well.
Exactly. And I think, for us, one of the biggest things is when they do come to us about for the MAT program, or we can help with that, but we can also help, like you said, with the mental health disorders or getting them therapy, because a lot of it goes therapy hand in hand too there. But also, let's get you primary care, dentistry. We can help with a little bit of everything, you know what I mean? We don't want to just help with this problem and then, all right, you're done. We want to help with everything, That one success story, and I know there's a lot of them, but that one success story is honestly what keeps us going, right? To keep the program going and making sure that we're making an impact on everyone's lives. So if we have one person that we can make an impact on, it's huge for us.
And the cool thing is, Well, we're getting a lot of our referrals now. So in the beginning, it was a lot of the hospitals, which we still do respond to the hospital overdoses. But now we're getting people just calling on their own. And we're like, how did you hear about us? And they're like, oh, my friend and I used to use together, and I saw him, and he said you were how he finally was able to enter recovery and do this. So people are not only becoming a success story, they're sharing it with other people they know are struggling.
Exactly.
And that's kind of like the best referral, because
It
when
is.
people tell you it worked for me,
Exactly.
you're more likely to buy in.
Word of mouth, it helps a lot.
Yeah.
It helps a lot. So, I think, the core program's huge for, not just Citrus County, but, the state of Florida as well. But it helps us, to make sure our community's safer and healthier in general. But you talked a lot about it, of drug abuse and mental health. A lot of them are hand in hand. And if let's say they didn't start with mental health, or, didn't have any mental health disorders, and they use drug abuse, then they can kind of lead to that mental health as well. So they kind of go hand in hand. Let's make sure that we can support them both ways. So that's most of what I had for you. I just want to ask, if there's something you could leave with our viewers, what would it be?
I think the biggest thing is, since it is May, going back to Mental Health Awareness Month, is just talk about it openly. Maybe make a post on your social media. Maybe share this podcast to your own personal pages, or a link to it. And that is how we break stigma. Is just making things normal.
Exactly.
When I go into the fire stations, I talk about feelings and emotions, and they're all getting used to it now.
Yeah.
And I even talk about suicide, and I'm constantly putting up information about suicide. So the more you talk about mental health, talk about suicide, make it a normal conversation, then it's not so scary when you're the one that needs help.
Exactly. So please check with your family, check with your friends, check with your coworkers, check with the person that's on the street, make sure everyone's okay. If you need resources, reach out to, Langley. We have a lot of locations that can help, and, in Citrus County, Marion County, Sumterville as well. But just make sure you reach out to people and make sure that they're okay, so check on them. So that's it for our episode. Thank you again for joining us.
You're
we
welcome.
appreciate it. Stay tuned for the next episodes, and we'll see you then. Thanks for tuning in to another episode of the Langley Connection, brought to you by Langley Health Services. We hope today's conversation helped you learn something new, feel inspired, and stay connected with the amazing people and resources in our community. Before you go, don't forget to like, comment, and share this episode with your friends, family, and coworkers. And be sure to follow us on Facebook, Instagram, X, and YouTube so you never miss an episode. From all of us at Langley Health Services, thank you for listening, and we'll see you next time on the Langley Connection.